Welcome to the Friends of Zane Adams, aka FOZA Podcast, bringing awareness of postpartum depression, suicides, and the children who are left behind. We'll be spotlighting positive outcomes from mothers as well as healthcare experts and counselors. Would you know the signs of PPD? Would you know how to help a loved one? Stay tuned. As a community, we can do more to support maternal mental wellness.
Welcome, FAZA family, friends, and supporters. This is Paulette Smith with episode 52 of the FOZA Podcast for Maternal Mental Wellness. Here we shine a light on awareness to stop the stigma, the silence, the suicides, and the suffering that can accompany postpartum depression, and we strive to support the education of children who are left behind. This is the first podcast of the year, and I'm really glad you came along with us. This episode is entitled, Maternal Health is Family Health. If it's your first time with us, meaning if you've never joined us before, we hope you'll take a few moments to check out last month's episode because it highlights the entire year. And then come back with us for this year. We hope that you'll subscribe to our channel and share the link to let others know about FAZA and the support and resources we all advocate for. Now, before diving in, let me take a moment to remind everyone that this is a safe place. However, our discussions may touch on topics that can be triggering. So if you're in crisis or need immediate support, please call 988. That's the Suicide and Crisis Lifeline. If you're not in an emergency situation, but you still need help or you still need someone to listen to you, please speak with your doctor or trusted professional. Whatever you do, don't give up if you're still struggling to find support. If you're looking for support in your local area, visit us online at FAZAinc.org. That's FOZA Inc.org. And check out our FAZA Finder services. We'll support you in finding resources in your zip code. You're never required to share sensitive information with us. Now, January is often talked about as a month of fresh starts, new goals, new plans, new beginnings. But for many families, the calendar turning doesn't ease what they're carrying. FAZA exists, as many of you may know, because on January 2nd, 2018, our Christina LaShawn Thompson Adams, died by suicide, leaving a 1-month-old son and a grieving family. Now, we're a Christian family, and we know that we had a pillar to lean on, and yet we struggled. We struggled to live with unanswered questions. We struggled to learn how to move forward without our Christina and to find a new language, a new way to communicate while we were still trying to find our breath. We were in a different space. We didn't really know where to find support as a family. So FAZA, Friends of Zane Adams, was created to build relationships, to network, to learn more, and to support birthing people, to bring awareness to postpartum depression, and to support the children who are left behind. Very important also, we created FAZA to keep everyone in mind that we cannot ever know exactly what's burdening another person. We don't know what burdens they may have, but we can show kindness and compassion. We can show that to everyone. And most importantly, we can learn how to be active listeners. Now, January 23rd, that's going to be coming around in a few weeks. And the nation recognizes maternal health awareness. We're starting the new year with purposeful mindfulness, that maternal health is not just about medical appointments, and it's not just about pregnancy. And it doesn't end at the end of the 6-week postpartum. We've also found that 6-week period can last much longer. So at FAZA, our mission lives in the spaces where maternal mental health may be missed and where somehow it isn't placed on the front burner. We know when that happens, the children who are left behind, they carry the burden, and they carry it without their mothers. So today we're talking about why maternal mental health must be included when we talk about suicide prevention, and what happens when it's not included. What happens to the children? I want to take a moment to share with you this comment that I thought was very insightful. Came from one of our podcast listeners, and it's about the treatment that we get as mothers, how treatment can sometimes vary, physical health versus mental health. Here we go.
When we talk about maternal health, most conversations focus on important issues, such as physical safety during pregnancy, access to prenatal care, birth outcomes, and equity. Of course, these conversations matter. Mental health is often mentioned too, but usually briefly, sometimes as a footnote. Often, maternal mental wellness is discussed as separate from physical health, as though emotional well-being is optional or a secondary consideration. When it comes to tracking, maternal physical health is tracked carefully, thoughtfully, and intentionally. But in too many instances, maternal mental health outcomes are not tracked as thoroughly.
After listening to that, I wanted to say thanks. Thanks to every one of you who takes the time to interact with us. So when you drop your comments in, we won't use your name or anything sensitive, but we do want to share with our audience sometimes what other listeners think, because your feedback reminds us that there's a gap in the action taken with physical health and the action taken with mental health. And that gap matters. We acknowledge that there are gaps, and I think everyone can say that every need is not being met. And we know that because we know that there are mothers still falling through the cracks. We know when mental health is acknowledged, but not fully integrated in the entire plan, then whole families can fall through the cracks. So this brings us to the part of our conversation that is sometimes being avoided. We call it the missing conversation. Maternal suicide is the missing conversation and is one of the leading causes of death, especially during the postpartum period. It's frequently underreported. It's sometimes misclassified, and sometimes it's not discussed at all. Postpartum depression, anxiety, and psychosis, they don't exist in isolation. They exist on a spectrum, and when untreated, they can become life-threatening. Suicide prevention can't be treated. It cannot be treated as a separate issue from mental health, because when we separate the two, we miss opportunities for prevention. We miss chances to intervene. And when families are left asking what might have been done differently, or what they could have done, or what they may have missed, then they are missing the opportunity to see a child grow into a life of love and light and caring with their mom. At FAZA, we believe this matters. When mental health is not adequately addressed, the impact doesn't end with the mother. It ripples outward. And the smallest people often carry the heaviest weight.
This episode of the FOZA Podcast for Maternal Mental Health is made possible by mission-aligned partners who care about postpartum depression awareness. Did you know that maternal mental health disorders affect 1 in 5 women, and that up to 1/5 of postpartum deaths are due to suicide? These aren't just statistics. They're families, children, and unseen broken hearts. Sponsorship of the FOZA Podcast supports critical conversations and resources that help families understand, prevent, and navigate maternal mental health challenges. If your business or organization is committed to supporting emotional well-being, community awareness, and compassionate family care, we'd love to explore sponsorship opportunities with you. Please visit fozainc.org/sponsors to learn more. Now back to the podcast.
Welcome back to the podcast. We want to take a little time to focus on children who may lose a mother to maternal suicide and how they can experience a kind of grief that sometimes goes unnamed and many times is misunderstood. For one thing, they may feel confusion, wondering what happened and why, especially depending on their age. Number 2, they can feel shame. They can feel the same shame that sometimes interacts with the mom. And we don't want that shame to be a part of their upbringing, because suicide still carries a stigma. And number 3, they may experience silence. People around them not talking, and they will stop talking because they don't know what to say, and sometimes people don't know what to say to them. Many of these children face higher risks for anxiety and depression. Some struggle socially, some struggle academically, and some even experience bullying or isolation. They can grow up without learning a language or having a language or finding a language to explain their loss. And they learn pretty early how to minimize their pain. They learn how to avoid questions. They learn how to grieve quietly. And tragically, some of them go into the future with suicidal ideation. At FAZA, our message is simple and it's firm. These children deserve acknowledgement. They deserve resources. They deserve compassion, not invisibility. Well, always, we talk about action. Awareness is our main goal. We also like to look at what we can do as a community to change the outcomes, because awareness alone isn't enough. So what does real change look like? It looks a lot like normalizing maternal mental health and encouraging screenings beyond a few postpartum visits. In this month of January, we're looking at National Maternal Mental Health. We want to look at normalizing maternal mental health. It also looks like supporting caregivers and families. We want to support the mothers. We don't want them to feel isolated, but we don't want families and caregivers to feel isolated either. When we're talking about real change and what it looks like, it means creating a safe place for children, a place for them to grieve and to be seen, without the stigma, the silence, and the suffering. It requires funding for prevention and education. It requires funding for long-term support. And we don't want to just show up for crisis response, because awareness without action leaves families carrying the weight alone. Often leaves them carrying the weight silently. We think they're carrying enough. So as we observe maternal health awareness this January, I invite you to hold on to this truth. Maternal health is family health. Maternal health includes maternal mental wellness, and it must include awareness of suicide prevention. We want to include the children They're sometimes left out of the conversation. And depending on their age, we don't always know what to say to them, but I'm definitely putting some resources on the FOZA website. And all you have to do is search on children, and you'll see a lot of resources come up. FOZA exists to keep the conversation going. So month after month, year after year, with compassion, honesty, and hope, yes, we hope to keep the conversation. So if today's episode resonated with you, I encourage you to reflect, to share, and to stay connected. Because when we widen the conversation, we widen the circle of care. Well, FOZA family, that's it for this episode. I want you to remember, you're not alone. You're never alone. The road to maternal mental wellness can feel overwhelming, but there are pathways and positive steps throughout every single avenue, every single path. FOZA is here to help connect you with resources and support. So for more information, visit FOZAinc.org. Together, we can break the stigma, stop the silence, save lives. We want to do that. We want to keep doing it. And we thank you for listening. We thank you for helping to keep our families and our children top of mind in 2026 in loving memory of Christina LaShawn Thompson Adams. Bye-bye.